Hi, my name is Madison, and I'm going to demonstrate how to do an intramuscular injection Z-track method. You're going to gather up your needed supplies, your medication vial, your dilute, the necessary sized syringe, and your the necessary syringe, your alcohol pads, gauze, and whatnot. So first you're going to perform hand hygiene, then you're going to say the 6 rights of medication, or you're not going to say it, but you're going to acknowledge your 6 rights. Right patient, right medication, right dose, right route, right time, and right documentation. You are going to check your MAR for what medication you are going to use. You are going to then determine how much dilute you are needing. So in this case, it is found on the back here. You could use, for depending on the strength, 9.6 milliliters, 7.1 milliliters, and 5.6 milliliters. We are going to do the 5.6 milliliters. So first we are going to put our needle on our syringe. Okay. We're going to uncap and place onto, just kidding, hold on, back step. I thought that this was off. Okay, so we're going to take our caps off. We're going to clean our tops. Now we're going to uncap. And we are going to inject into our needle for our air for our medication. So this we are going to pull back 5.6. Okay. And then we are going to insert it into our dilute. And then we are going to insert the amount of dilute. It should be 5.6. Okay, take it out. And then we are going to insert it into our medication. We're going to clean the top of that again. Insert our amount. Ooh. Apparently we overpressurized it. So then we are going to cap it with our one-handed technique. We are going to roll it gently in between our hands. We're not going to shake it. Okay, it looks almost there. Okay, so now that we have our medication, we are going to draw up our order. So we're going to uncap we're going to draw up the prescribed dose, a 1/2 ml. And then tip it. Oh, we're going to inject our air. And then we are going to hold back our medication. Remove any air bubbles. Okay. We're going to inject it. Check our dose. Recap. Okay, I didn't do that. I did that with my one-handed technique. Oh. My one-handed technique. Okay. Now I'm going to go into my patient's room and have 2 forms of identification and explain the procedure and the medication. I'm going to demonstrate how to, I'm going to position them appropriately. So either the ventilogluteal or the the one in the top part of your leg. So if you want your ventrogluteal, you're going to have them lay on either stand or laying on their side. The one in your upper thigh, you're going to have them sit or lay supine or sitting upright. So we have our patient, we've identified. Now we're going to perform our hand hygiene and put on our gloves. We're going to clean in circular motions at our site. We're going to allow time to dry. We're going to uncap. We're going to hold it kind of like a dart. With a non-dominant hand, you would scoot the extra skin back, but because it's an orange, you're going to have to hold it. So you're going to hold it like a pencil or a dart, and you're going to insert it at a 90-degree. Aspirating, making sure you don't get any blood return. If you do, you would start over with or go and get new medication. Then you're going to slowly, you're going to hold it with your non-dominant, and you're going to inject slowly, and then you're going to inject, you're going to blot it with a gauze, but you're not going to massage it. You're going to dispose of your needle into the sharps container. You're going to place them into a comfortable position. Make sure that they're comfortable, and then you're going to document the procedure and make sure that you document the dose and the time and the site that was given.